I shared lang po yung tatlong concerns. The first is yung granularity of the data and real-time data, because I noticed when you're watching CNN during interviews po ni President Trump and of course Governor Andrew Cuomo, you can see yun pong yung kanilang real-time data, tsaka po yung yun pong kanilang curve pinapakita po nila. And then you can see on the screen as well na nagbabago yung data po nila on the cases as well as the number of deaths po. Para kung during the election time, nakikita po nyo. Sa tingin ko po very important yun kasi you can make right decisions at the moment, also for some of the local government units. And second kong binring up po ay yung because of the second wave in Singapore, because of the migrant workers nila, nagbalik po, tumaas po yung yung cases nila. And right now, sila po yung number 1 ngayon sa Asia. Right. And then number 3, feedlog ko rin po na in June po, there will be, it's the start of the rainy season and we're visited by 20 typhoons a year. So, pag tayo nagkaroon ng floods, there will be increase in the cases of dengue, pneumonia and flu, which can actually cause some problems in diagnosing COVID. And they will go to the evacuation centers. And this will negate the primary gains of social distancing. So I alerted the key opinion leaders as well as the president that this should be taken into consideration. So there's a saying, John F. Kennedy, na we need to fix the roof while the sun is shining. So, ang ibig sabihin, yung decision whether to maintain, modify, or lift the lockdown, we have to take into consideration not only the lowering of the viral spread based on the DOH data, increasing the healthcare capacity, yung mga testing centers, testing kits, yung mga PPEs na binagit po ni Senator Meigs, at saka yung mga medications. But we should look into the possibility.
Dr. Leachon,
Please look into the possibility of preparing the nation for a second outbreak. According to the literature, yung 1918 pandemic, meron din pong outbreak. And ngayon, nangyayari nga po sa Singapore. And then sa Hokkaido, sa Japan, nag-declare po si Prime Minister Abe ng national emergency kasi nag-increase din po ang cases nila. And these are first world countries na nagkaroon ng spikes because of the spike.
Where was the conversation gearing? Was it gearing toward an extension, whether modified or not?
Well, yung iba nagsasuggest, pero ako personally, knowing what I know, and I'm in a unique position kasi naririnig ko yung IATF, tapos I work po with Secretary Galvez, the Chief Implementer, tapos naririnig ko yung preparation ng LGU. Ang tingin ko po personally, yun pong ating viral spread ay hindi pa po controlled kasi nag-i-increase pa rin yung cases po. Saka yung deaths po natin, meron pa rin po. One of the most important things po na nakalagay sa literature, pagka-incident of new cases, it must be at the level that the healthcare system can manage. Yun ang number 1 consideration. And number 2, must have substantial clinical capacity in reserve. Sa tingin ko, kung meron traffic light dashboard, it might be yellow. Ang red kasi is far below the target. And then green means the target. I think we're, sorry po, I think we're yellow here. And I don't think in 9 days we'll be able to achieve that. Kasi I have not seen the curve ko, the Philippine style. And nakikita ko pa, hindi ko po anong consistent basis.
You could see na ang sinabi niya, no, patulad ng binanggit ko kanina, at tinihintay niya po yung mga numero, at sa mga numero nakikita po niya na yun, parang malabo pa, marami pang nako-contaminate at nadadagdagan po na nadadagdagan ang listahan kaysa humihinang ang listahan. In other words, we're gaining ground actually, tumatas yung mga ating mga patients na positive. So, katulad ng binanggit niya, ayaw niya po nangyari sa Singapore at sa Japan, Hokkaido, Japan, dito sa atin. So I think we may need to extend another 15 days. I am with the group doon sa Senado na, pumapayag or sumusuporta sa extension for another 15 days.